We're a bit squished in here, aren't we? We're a bit squished, aren't we, James?
We are a little bit.
Honestly, the nerves are jumping around. I feel like I'm not qualified to be standing up here.
No, it's great having you guys. It's really...
No, it's awesome to be here. Seeing how it actually all
Oh, those lights are bright.
Yeah.
Let us know when we're ready to go. Good morning, Queensland. Can I please have some quiet? Good morning, Queensland. Good morning to our Facebook viewers. Great to be here on a beautiful Brisbane morning at Maple Park State High School, which is one of our vaccination centres during our Super Schools Vaccination Blitz. And we've got over 100 schools right throughout Queensland that have got their doors open and are accepting walk-ins, so you can receive your first or second dose. And we encourage everyone who hasn't been vaccinated to obviously come forward and get vaccinated. Can I say that today is another double donut day? We've had 0 cases, and that's very good news for Queensland, and of course very good news for schoolies kicking off on the Gold Coast today. We had 8,724 tests. We have 7 active cases, which is wonderful news for Queensland, and we have just over 84% of Queenslanders first dosed and 72.6% of Queensland double dose. So we're etching our way closer to that 80% double dosed, and when we reach that, obviously there will be further restrictions that will be lifted. We know our schools are an important part of our local communities, and it is great to have these vaccination blitz weekends now where they'll be open on Saturday and Sunday and welcoming people to get their first dose. And of course, if you need your second dose, it's a reason to make it easily accessible for you to get your second dose as well. Can I thank Principal Mick Hornby from Maple Park State High School that is here with us this morning for opening your doors, Mick, and it's wonderful to have the student leaders here as well, and they're the leaders that will be taking over leadership in 2022. I'm also excited that we've got 3 Bronco members here as well. We've got Tyson, Payne and Jordan from the Brisbane Broncos, and Tyson's going to say a few words after myself, and they're lending a hand with a lot of other sports and athletics champions of vaccinations at the 100 schools across the state. Athletes from the Brisbane Broncos, as we have here, Queensland Reds, Gold Coast Suns and Gold Coast Titans, Brisbane Roar, Queensland Firebirds, JCU, Townsville Fire and Swimming Australia have got behind the Super Schools Vaccination Blitz, and we want to thank them sincerely. So if you want to see one of your local sporting heroes, and if you want to see the Broncos here as well, and we've got Minister Shannon Fentiman with me, who's a local member, and she was talking with the school captains who were very impressed about meeting Tyson, Jordan and Payne as well, which is fantastic. We've chosen the 100 schools in the areas where we need to get vaccination rates up. Can I encourage everyone to come out and get vaccinated? Obviously, if you have any concerns, as the Premier and others have said time and time again, please see a trusted medical professional, your GP, your pharmacist, whoever you trust, have a talk about it. But we would like to see those vaccination percentages come up and hopefully reach the 90+% as soon as possible. Every person that gets vaccinated decreases the risk when we open our borders fully to having Delta come into your home. It will hunt out those that aren't vaccinated. So we encourage all Queenslanders right across Queensland to do the right thing. Take advantage of the Super School Blitz weekend with over 100 schools open, and of course your GP, your pharmacist and other areas where you can get vaccinated. We've had very successful school vaccination blitzes in the past. Over 25,000 Queenslanders came out to get vaccinated, with the vast majority of those being the first doses. So it's fantastic, and we want to continue to see that success. So thank you everybody for coming out today, and the Chief Health Officer, the Deputy Chief Health Officer James Smith, I'll pass on to him to update us even further on our COVID figures, and I want to thank once again Maple Park for having us here today. James?
Well, thank you very much, Minister. And as Minister's already said, it's a great day in as much as we have 0 cases to report over the last 24-hour period. So the total case number remains at 2,112 and 6 people in hospital, no one in intensive care at the moment. So that's really good news. And I think the Minister's already mentioned the coverage numbers, but it's 84% for first dose and 72.6% for dose 2. So that's coming up, and that's really encouraging to see. Vaccination is the only way that we'll get out of this. It is our path out of here, and the more that we can vaccinate, the greater numbers of people out there who are vaccinated, the less that we have to do societal restrictions, so things like lockdowns. So it's really encouraging figures. It's great that the numbers are climbing, and we want to see them continue to climb over the coming weeks so that we can essentially get our lives back and get our freedoms back. It's very, very important. So thank you, and great to be here at Mabel Park State High School. Beautiful school, and one of 101 schools that are hosting pop-up clinics around Queensland this weekend. 12 of those schools, I'm told, have sports stars, so sporting personalities there in Townsville and southeast Queensland, so that's great to see. It's the sporting and recreation weekend, so it's really good to see those sporting stars come out and support the program. So thank you very much.
Shannon? Great to be here at one of my favourite high schools, Mabel Park, and we know that our Mabel Park families love their rugby league, so it is so great to have the Broncos here today because they are such great role models for not only young people in our community here in Logan, but for our families. And however that we can get that message to families here in Logan that vaccination is safe and that it is so important to keep our family, our friends and our Logan community safe, I think it's fantastic that we have the Broncos here with us today to really help us deliver that message. If we want to get back to normal, if we want to go out to our restaurants and cafes, then we need to get vaccinated by December 17th. I'm so pleased to see so many local schools have these wonderful pop-up clinics as part of Super School Vaccination blitz. I know, talking to the staff here, there's already been a steady stream of people coming through to roll up their sleeves to get their vaccination so that we can keep each other safe here in Logan.
Here. Tyson, or maybe, yeah.
Me?
No, yeah.
Oh,
Tyson,
okay.
you say a few words.
Yeah, as if I wasn't nervous enough.
You also ask you some questions to make it easier.
Yeah, please.
So I guess throughout your career, you know, people look up to you. What's it like now to be able to tell people to go and get vaccinated that aren't, I guess?
Well, for us as players, it's good to show the support to the people that are getting vaccinated. I mean, they support us on the footy field, so there's no better way, I guess, to help the communities out around Brisbane, in getting their vaccination.
What would you say to anyone, you know, that's a little bit hesitant? You've had it yourself. What would you say to them?
That's not as bad. That's what you think. I think the worst part about it is the sore arm you get after you get the needle. But yeah, it's all for the betterment, I guess, of Brisbane and of each individual community around in the surrounding areas. So if you want to get back to normal life, I guess it's what we have to do.
Would you like to see Payne get up and say a few words?
Absolutely. I'll do it. I don't want to stitch him up.
I guess for you guys, life has been, you know, been in the bubble. You know, it's difficult for your families and things as well. But now you're out of that because you've got the jab. What's life like for you now?
Yeah, it's good. It's sort of somewhat back to normal, I guess, for us as players. But we started pre-season a few weeks ago, so that's probably the worst part at the moment. But yeah, it's getting back to normal, which is a bonus for, as you said, not only ourselves but our families and everybody else involved.
So talk us through a little bit about what it was like, you know, being in the bubble, away from your families, or I guess away from normal life, but not even being able to go to a cafe. Yeah,
well, we weren't allowed to go into cafes, so if there was drive-thrus we could stop and get a coffee, but most of it was, sort of, if you weren't at home you could only be at training, or you could go to sort of Coles and Woolies to do your general shopping, but yeah, it was to and from. We had to log wherever we were stopping, wherever we were going into app that we were given from the NRL, so it was a bit hard to take at the start, but I mean, we were in it for a while, so you sort of got used to it.
Is it a privilege to be asked to come along to these sorts of events and encourage people in the community to be vaccinated?
Yeah, as I said before, it's they show their support to us on the field, so it's only right for us as players to sort of show our support back to the community and get out to here and take a few photos, sign a few things, play with the kids outside. But yeah, it's an opportunity that doesn't really come around often for us, but when we do get it, it's great. We're all grateful for it. Thank you.
Thanks, mate.
My favourite team is South Sydney Bunnies, but I'm going to make Broncos my second team just because of what Tyson just said, because that was very well said. And look, I just want to say thank you so much to our local member, Shannon Fentiman, our Minister, Education Minister, Grace. It's just a brilliant concept, and we've got kids that are coming out here. We've got our school captains here. Our families are coming in the door, and we've even got things like Vivo for a Vax, which is reward points for our students when they get a vaccination. We've got a free barbecue. So it's just about bringing our community to somewhere close, easily accessible, and we put on a little bit of food, and the hope is we get more people coming in our door and getting vaccinated.
Do they get a bit of extra brownie points if they come along?
Definitely. So the Vivo points, actually, they trade those in, and one student actually traded them in for lunch with me, which is crazy. But but yes, they get reward points, and it's just a good concept. Done. Thanks, guys.
Oh, there will be within it.
Okay. Thank you very much, Principal Mick Hornby. And any questions at all?
Minister, we're expecting to see a big protest in Brisbane today. There's petitions for the Parliament's website which has about 50,000 signatures against the mandate. What's your message to those people who say that their liberties have been taken away by not being able to go to the cafe?
I think we are facing a world health pandemic here, and I think we want to keep Queenslanders safe. Queensland has done a remarkable job. We're world leaders when it comes to keeping Queenslanders safe, and I would say to them they can exercise their rights. Of course, it's a good part of democracy, but our focus and our concentration is on opening Queensland up. We want to get those vaccination rates up as soon as possible so we can open up Queenslanders safely. That is our focus.
What do you make of the protests, both anti-vax and anti-anti-vax, going on at the same time?
Yes, there's all different slogans that are being bandied around at the moment in relation to this, but I think we've got a clear and sensible pathway here in Queensland. We urge all Queenslanders to get vaccinated. That's what this weekend blitz is all about. That's our focus, and that's what we should be talking about. And I think any double speak that distracts from getting vaccinated, we believe is reckless and unwelcome.
Minister, the government's message has always been keeping Queenslanders safe. This is from the police. This is on PCR tests. This ridiculous rule around PCR tests that some people will have to pay $150 to come up here to Queensland. An email put in yesterday and sent back to Channel 9 from the police saying there is currently no requirement for police to distinguish where a PCR test is undertaken. That's ridiculous. That means now someone can get a test in Queensland, drive to New South Wales for 72 hours, drive straight back, and the police will not do anything to them. It completely debunks the theory that we need a test to come over here when the border's open.
Look, I think I'll get the Deputy Chief Health Officer to address this in relation to some of the issues that you've raised here at the moment, but PCR testing is a preferred testing at the moment. Whether you can claim...
But Minister, the police are saying that they're not going to check it. That there's no distinguishing in where you get the test done. So if you get the test done here in Brisbane, go to Sydney for a day trip and come back. How is that keeping Queenslanders safe? You're going to COVID Rapid Sydney to come back. Yeah,
thank you. Just give me an opportunity to respond to you. I'm not aware of situations like that occurring. I'm not sure that the police have actually seen a lot of those occurring at the moment. I think the Deputy Chief Health Officer here is to talk about the value of those PCR tests at the moment. I agree, Medicare should be reimbursing families. That's a Commonwealth issue. Medicare is dictated to by the Commonwealth, but I think the Deputy Chief Health Officer would be more than willing to say a few words in relation to that as well. But the prime objective here is a measured and balanced approach to ensure that we keep COVID out as much as possible, that we keep... Well, it may not be the complete opposite. I'm not sure exactly that is necessarily occurring in line with what you have said, but I'm sure that if there are gaps, we'll fill those gaps and we'll make sure that it's a sensible and measured approach. But I think James Smith would be more than happy as Deputy Cho to say a few words on this.
Would you see that is confusing? The messaging is confusing. We're already being told, and the tourism industry is already collapsing here, and they're already saying that for a family of four, that's $600 to come into Queensland, right? And to get this PCR test done, you're all talking about keeping Queenslanders safe, yet the police, the Queensland police said yesterday, they will not distinguish where a test is done. Can you see how your entire system is a failure?
Well, I think the important thing to remember is that the Uniting Families policy is about bringing Queenslanders back into Queensland, and that's a key focus of the policy, is to bring people back. I think, yes, people may want to do day trips, and there's a lot of things that need to be worked through for that, but the policy is designed around bringing people into Queensland. So I know everyone's keen to get to New South Wales and to other places, to Victoria, and do business trips and things like that, but that's not really what the policy's about. There are things that will need to be worked through, wrinkles, people who do want to go just for a day or a couple of days, and as you've rightly pointed out, getting a test within 72 hours and getting the result back is a challenge.
The test should be done in Sydney or in Melbourne, not here in Queensland. This is the government's stance is keeping Queenslanders safe by getting these tests done. However, right now, as it stands, when the border opens, I can get a test wherever I want, go to Sydney within the 72 hours, go out in Bondi, do whatever I want in COVID-ravaged Sydney, and return, and the Queensland Police will not distinguish where I've had my test done. It completely debunks what the government is telling us to do.
Well, look, certainly take your point, but I'll go back to the fact that this is about bringing people into Queensland, people who want to be in Queensland, not people who want to do quick trips out of Queensland and come back again. So there is stuff that needs to be worked through, and I know that there's a lot of refinement that's going on with the Uniting Queenslanders policy in coming weeks before we hit the 80% mark.
And what about rapid antigen testing? Is that going to be a consideration, considering the cost of PCR tests? The other consideration here is that when people do go to get the PCR test, the government's under no illusions that people are just going to go to a pop-up clinic and get it done for free and say, I've got a sniffle. That's going to cause a backlog in the system. Sydney's, Melbourne's testing numbers will be 100,000 a day because people don't want to pay for the test.
I mean, you're right in terms of the criteria. So anyone who goes to a clinic with symptoms, or who is under a public health direction, or who is known to be a contact of a case, can be tested, and there'll be no charge attached to that. So that is important to remember that. And it's also important to remember that the Commonwealth funds testing through Medicare. So
For people with symptoms?
For people with symptoms, or people who are under public health orders, or people who are close contacts. So certainly the vast majority of people getting tested will get it done for free. And I'm sorry, I forgot your other question. Oh, rapid antigen testing.
Yeah.
Look,
considering that diseases experts are saying that if you don't have symptoms, rapid antigen is a very successful test, and it would cost families far less than what it would for PCR testing, and it would relieve the system.
Well, rapid antigen testing will become an important part of the testing strategy moving forward. The thing about rapid antigen testing is it's much less accurate than PCR testing. And when we're in the phase that we're in at the moment, which is we've got no coronavirus in the community, it's very important to make sure that a negative test is truly negative, and that you're not missing people coming in, and that a positive test, in fact, means the person truly does have coronavirus infection. We don't get that same level of guarantee with a rapid antigen test. And without going too much into the statistics, because I'll very quickly get lost myself, but it's very dependent on the underlying incidence of coronavirus in the community as to how accurate the rapid antigen tests are. You actually need to have the virus circulating within the community for it to become a useful test. So we have recently bought a significant number of tests for use in Queensland Health. Moving forward, we will probably find a place for those to be used. Right now, they're not on the agenda, though. It's something for the future.
Question for the Minister. Just a question for the Minister regarding your Keppel MP. She received a death threat along with currently a few other MPs, and it's presumably to do from the anti-vax movement. What's your thoughts on that?
Oh, look, totally unacceptable. I mean, honestly, have your views, but we're hearing that a lot of members of Parliament are getting these kind of, you know, either their emails or certain phone calls into our electoral offices. Look, they are totally unacceptable. Everyone deserves to be safe at work, including politicians and other members of the community, and I would say to them, please stop. It's not helping anybody, it's unwelcome and it's reckless.
Minister, just leading into the end of the school year, obviously December 17, last day of term, that's when we think the borders will open. If they don't, you will most certainly have to be in a position where you make a decision on mandatory vaccinations for teachers. Is that being discussed in Cabinet at the moment?
It's under active consideration at the moment with regards to what happens to school staff. We're not just going to do teachers. We were the first state to move to have all school staff, volunteers and early childhood educators on the 1B category. We're the first state to do that. We've had a fantastic response. Over 85,000 people have been vaccinated on that 1B, and that doesn't include those that have walked into GP clinics and pharmacies and clinics like this. So we're very confident that the percentage is very high, but it is under active consideration and it is something that we'll be considering. But school breaks up for the year on the 10th of December. We're looking at opening up on the 17th, and hopefully we'll get to 80% sooner and being able to possibly make a decision of bringing that forward if we reach that 80%.
Just on schools, what about school this week? Any message for the
Yeah, look, congratulations to Year 12 students. I've seen we have the captains for next year here, and I met the captains at the school with the minister here before. It's been a tough year with COVID looming large over our heads, but they've done a remarkable job, and I wish them all the very best. Stay safe, make sure that you're vaccinated, of course, and enjoy your time. It's a once-in-a-lifetime experience, and I hope that they have a safe and happy schoolies on the Gold Coast. And the green light is there because we've kept Queenslanders safe.
Minister, in regards to the co-location of the maternity and gynaecology services at the RBWH, the union's been campaigning for weeks. People that have suffered have been campaigning for weeks. Why would it take the front page of the Courier Mail for Queensland Health to act and reverse the decision?
Look, I understand the Health Minister has put out a statement in relation to this, and the proposal has been withdrawn. We all share the concerns in relation to what has been raised, and it will be fixed.
Did the hospital get it wrong?
Of course, yes. I think that when you say wrong, the RBWH is in my electorate. It is a fantastic hospital. Wonderful services are offered at the RBWH. This was a proposal. I think they've been made aware that there are a lot of concerns out there with stakeholders, and my understanding is that it will be fixed.
How could it be allowed to have happened in the first place?
Well, that's a good question, but I think that's something that the Health Minister has addressed in her statement.
Is the Health Minister avoiding fronting cameras this morning to avoid scrutiny?
No, not at all. We were lined up to do this yesterday, and we're at our Super Schools Blitz. I'm the Education Minister, and it's my turn to stand up and to face the wonderful viewers on Facebook and others that have tuned in. And we're very happy to give the good news that we've got a double donut day today, and that if you're not vaccinated, get out there, go to one of your schools and receive your first dose and your second dose, whichever one you fit into the category.
Minister, do you find it unusual that, as it stands here in Queensland now, you have to have a jab to be a barista but not a teacher?
Look, I think at the moment we are encouraging everybody to get vaccinated. We are saying that at this stage we want as many people as possible to get out there and be vaccinated. What we're saying is that if you are unvaccinated, when we open up and Delta comes in, under the health advice, you are going to be restricted in what you can do if you are unvaccinated. There are many businesses at the moment that are requesting their staff to be vaccinated, health workers, for example, those in aged care. Look, at this stage, we have not moved to mandatory vaccination. We have put them on category 1B, and as I said, it is under active consideration.
Last question, anybody? All good? All right, thanks so much, guys.
Terrific, thank you.